transparent.
Well, let's move to the international scene where President Trump has officially signed a memorandum pulling the United States out of 66 international organizations. From the front lines of climate science to the agencies supporting mothers and children, Washington is closing its doors on the multilateral systems. But as the U.S. reclaims what it calls sovereignty and accountability, a massive financial and humanitarian vacuum is opening up across Africa. In Kenya, the medical backbone of our country, built over decades of American partnership, is beginning to fracture. Our reporter Marion Barasa breaks down what the big pullback by the U.S. means and what is likely to happen to the Kenyans affected by America's exit.
By pulling out of this 66 group, the Trump administration is effectively declaring a total war on globalism, signaling that Washington will no longer underwrite a system it cannot fully control.
That's why in America I withdrew from the fake Paris Climate Accord, where, by the way, America was paying so much more than every country.
Rid of USAID, we brought all that foreign aid under the State Department so that now, when we give money to countries, we know where the money's going and we know we're helping our allies and our friends.
For Washington, it's about reclaiming sovereignty and accountability. But here in Kenya, that high-level ideological shift translates into a very practical and immediate crisis. The sudden disappearance of the institutional machinery that has kept the nation's clinics running and its climate defenses intact. The U.S. previously provided $470 million in annual foreign assistance to Kenya. Research from Physicians for Human Rights indicates that 41,500 health workers are supported by U.S. funds. With the withdrawal from these groups, thousands of nurses and clinical officers face immediate layoffs. Several antiretroviral therapy clinics were temporarily closed, some without proper referral systems, such as HIV prevention outreach and peer support services have also been suspended.
Kenya is going to suffer in the sense that the workers who are not able to be absorbed adequately by the SHA system will definitely look for greener pastures elsewhere. And of course, the country, in the long run, the country would appear like it loses in terms of the human resource labor.
The supply chain for essential commodities, including ARVs for HIV treatment and TB reagents, is heavily subsidized by the US. The stop work orders have already led to stockouts of childhood vaccines from the UN Population Fund is a direct blow to maternal health. UNFPA provides the safety net for safe births and contraceptives access in Kenya's rural areas.
We know that there will be a ripple effect after the decisions made by the U.S. administration. Just as of early this morning, I was reading a report about the U.S. having pulled out of about 66 agencies, some of which are UN agencies. And so what then happens to accommodate the people who are losing their jobs as these changes are being made?
In December 2025, a new $2.5 billion health cooperation framework was signed between President Ruto and the U.S. President. While this direct bilateral deal provides $1.6 billion in U.S. support, it requires Kenya to co-invest $850 million. This places a massive burden on a Kenyan budget already strained by debt and the transition to the Social Health Authority. Marion Barasa, KTN.
Well, interesting developments there from the